Home beauty devices and gadgets definitely have their appeal. I mean, they offer a range of skin and hair benefits at the convenience of your home, but do they really work? Most of them are pretty expensive, so are they worth the splurge? Well, today I want to share with you 3 devices that I, as a board-certified dermatologist, use at home, their science, and why I choose to use them. Hello, or welcome back to my YouTube channel. My name is Dr. Jenny Liu. I'm a board-certified dermatologist, and I love sharing as well as educating and creating content around skin and hair. That sounds good to you? I would love it if you can give this video a thumbs up and subscribe to my channel. So over the years, we've seen a huge uptick in the number of at-home devices, gadgets, tools, and really touted to provide skin and hair benefits, and some even marketed comparable to what you would be able to achieve with professional treatment. So, if you're in the market looking for an at-home device, whether it's anti-aging, acne, or hair regrowth, not sure what to get, or just curious about this topic in general, you've definitely come to the right place. We still need more research and data on the efficacy of all the devices that exist on the market. A lot of it is just truly marketing. We definitely have evidence for some more than others. These devices are not a replacement for professional treatment that you may get from a dermatologist. It doesn't matter how many LED mask sessions that you perform at home, you're definitely not going to get the same benefits and results compared to, say, getting microneedling or laser treatment. They don't replace skincare. Skincare, a good solid skincare routine is really going to be the most important, nor are they better than tretinoin, sunscreen, moisturizer, and just a good established skincare routine that you can do consistently. Just because they're meant to be used at home, it doesn't always mean they're safe. Not all devices are created equally. Certainly, there can be a risk of infection, irritation, hyperpigmentation, eye injury. I remember reading in the news back in the day about certain masks being pulled off the market. You just really want to do your research and make sure you are using the right device to target your concerns, but also appropriate for your skin type and skin tone. And in general, what you want to look for when it comes to these devices is that they're FDA cleared, which just means that companies have to submit evidence that these devices are safe according to certain FDA guidelines. But just because they're safe, it doesn't mean they don't come with adverse effects. So always want to be careful and do your research beforehand. And because these devices are not really viewed as medical treatment, they don't undergo as rigorous of testing compared to even some of the common topical medications that we recommend, like tretinoin. So just because they're on the market, it doesn't always, number one, mean they will produce the same results, and definitely doesn't mean that they are safer. So what are some of the devices that do have evidence supporting their use? Number 1, LED devices for acne, fine lines, and wrinkles, and then laser and LED devices to support hair growth. There's also some evidence on radio frequency for skin tightening, supporting collagen, and similarly, less evidence on microcurrent devices for that as well. And then lastly, intense pulse light devices for hair removal. And then with the latter, I think the thing to think about is that if you are skin of color, you may want to shy away from using those because the risk is skin irritation and then hyperpigmentation. The most important thing is that consistency is key when it comes to these devices. Just like skincare, they're only as good as you use them, right? And many of these devices do require a bit of investment time-wise. And so if you're not able to keep up with it, you're definitely not getting the most out of your devices. And honestly, then I think it's personally a waste of money. Right, so the devices that I personally use are number 1, LED devices, mostly for anti-aging, not so much for acne. 2, an LED laser hair device for hair regrowth. I've mostly been using it my postpartum journey to help reduce hair shedding. Last one I use intermittently is a microcurrent device, and that is because, again, I already am pretty tight with my time and what I'm able to do, and the microcurrent, because it has the least amount of evidence, it's something that I would do really just to help to temporarily lift and tone my skin before an event, or say before before I film if I look really puffy and swollen. Okay, so let's dive into LED devices. This is a term you see all over the place. It basically stands for light emitting diode. Essentially, the devices that exist on the market pretty much just have wavelength within the visible spectrum. And when it comes to skin and hair, really it's the blue, red, and to a degree infrared light that really has been shown to be helpful. In particular for acne, blue light and red light is what really helps in offering antimicrobial and anti-inflammatory benefit. Blue light usually comes in the wavelength around 450 nanometers, and red light usually around 660 nanometers. The bacteria that causes acne, through their metabolism, creates molecules that actually absorbs light, and we call that chromophore. And that's kind of the idea behind laser and light devices when used in office. We really take advantage of these molecules that absorb a specific wavelength of light, and here it's really the blue and red light. And when it's absorbed, that light really can't do anything, and it basically creates, there's energy from the light and it generates heat, and therefore creates a chain of reactions that ultimately creates free radicals and then destroys the bacteria, and also indirectly through that process reduces inflammation. And so that is how light treatments at home devices, as well as in office treatments that we call photodynamic therapy, really works in targeting inflammatory conditions like acne. For anti-aging, is really red light and infrared light that's been shown to be helpful. The longer the wavelength, the better it's able to actually penetrate, go deeper into the skin, and that is true for infrared light. It's about 800 plus nanometers, so longer than red light. And studies have shown that the two combined, in particular infrared, can help with stimulating fibroblasts, supporting collagen, stimulating collagen production, and then over time with use may help reduce the appearance of fine lines and wrinkles. I have been incorporating an LED face mask into my routine on a weekly basis for the past, I would say, 5 to 6 months, and noticing some decent results. And the device that I use is from Omnilux, and it's their contour face and neck chest mask. Reasons why I pick Omnilux: number one, they are actually probably the only device that I'm aware of, as far as like in the LED device world, that has the most number of publications and literature backing their efficacy. Omnilux actually creates a medical grade light treatment, so for derm offices to be used in our office professionally. So they are definitely a trusted brand when it comes to creating effective devices for at-home use. Contains 132 LED lights. This is great. It's flexible. It's made out of silicone material, and it has these elastic bands on the back that you can use to tighten and to really secure the mask to the contour of your face. And they do make a separate one for the neck and chest. This is another one I use at the same time as my face treatment, and then as well as one for the back of the hands for anti-aging. And so I haven't tried that one yet, but certainly maybe one of these days. I like the fact that for most of, and this is true for most LED masks, that you kind of basically do 3 to 5 10-minute sessions weekly. I think the time may vary per device, but this one is 10-minute long, and it basically, once you turn it on, it will time off on its own when the treatment is done. And so really for results, you do 3 to 5 times a week. I usually do 3 just because 5 is too time intensive for me personally. And then this does come with a portable battery pack, so that way you're not tied to like an outlet, so you can certainly walk around. And these devices do need to be used on clean skin, so often I'll do this, in the morning or at night after I wash my face. Put this on clean skin, clean dry skin, do my treatment, and then I would basically re-dampen my skin, spritz my skin with a little water or essence. That way I can finish off the rest of my skincare routine. Now, result-wise, I would say the biggest difference I've noticed on my skin is actually the reduction of my neck wrinkles. So first and foremost, I take really good care of my skin. I have a consistent skincare routine morning and night that I stick to. I think medical procedure wise, really, I've gotten a few sessions of microneedling, and then I definitely do Botox. And I do feel like overall I don't have a lot of deep wrinkles. I certainly have fine lines at my age now, being in almost 40. I am one individual that have not received any procedures on my neck, and I have tech neck. I'm very guilty of always being on my phone, at the desk, on my computer. So I'm always, flexing in my neck. I have noticed over the past 5-6 months with the consistent use of the neck mask, because my skincare routine hasn't really changed significantly, the wrinkles on my neck have definitely softened up a lot more than before. It's hard to gauge how much change has happened on my face just because I had minimal concerns to start with, and because I feel like I take good care of my skin, it's really hard to notice improvement with facial skin. But the goal with treatment is overall hopefully maintenance, and then just keeping my skin as healthy, as youthful as it can be. The next device I use is a laser hair device to help support hair regrowth. And this process is called photobiomodulation. So basically using low-level laser therapy and light devices to create energy and metabolic changes within the hair follicles, and thereby almost act like nutrients for your hair follicles and supporting hair growth. This photobiomodulation actually has been fairly well documented in literature for it to support hair growth. Now, when it comes to hair growth though, it's not one thing. This is certainly not the most effective thing that you should be doing if you're experiencing telogen effluvium or androgenic hair loss. Prescription medications often have the best results, but for individuals who are not interested or cannot take a medication, this would be a good alternative. Or it can certainly be combined with everything else that you're doing, prescribed by your dermatologist to yield potentially better results. The hair device that I use has been iRestore. Now, when it comes to laser hair devices, this one as well as Hair Max Comb are the two that I recommend to my patients. The Hair Max Comb is a very similar device. It's just that it's in a comb, so you actually have to basically hold it on your scalp and work it through your scalp. This helmet is convenient because I just put it on. It does come with a portable battery pack, so I can certainly walk around, or I can just freehand do something else. Often I'm doing closing charts or finish up emails at home. It's also really nice because it's about 3 sessions a week for 20 minutes or so. And I definitely feel like this time around postpartum, I've had less hair thinning, shedding compared to the first time around, because I feel like I'm just taking better care of my body, scalp, and then using this device. I have not been able to use minoxidil, which is the topical that I would otherwise like to use this time around, because I've been struggling a lot with scalp oiliness and dandruff, and I've tried to use the minoxidil and it just made my scalp super itchy and greasy. So this was the compromise, but I definitely feel like overall now 1 year plus postpartum, it's certainly helped. And overall too, I feel like it's made my hair stronger and healthier. And one last thing I just want to mention before we jump into the third device is you really need to upfront invest the time and energy. It takes a lot of time to improve wrinkles, and it is very metabolically demanding to grow hair. You're not going to get any instant results overnight. I didn't even notice improvement in my neck until a week or 2 ago, and I've been using the neck mask for about 5 to almost 6 months now. Similarly, for hair growth, I would give it at least 6 months. Even when it comes to topical minoxidil and oral medications, we say at least 3 to 4 months, if not longer. So you really need to kind of put forth that energy and really be consistent with it. And even with that, the results can still vary. So this is one of those things where you just have to be patient and give a good effort. And then at the end of the day, after 6 months or longer of use, you can kind of certainly decide if it makes sense for you to continue. And the last device I use, probably the least amount, seldomly, is NuFace Microcurrent device. Microcurrent is basically using safe low voltage of electricity, and when applied onto your skin may polarize certain cells and have been shown to help maybe stimulate fibroblasts to create more collagen, and thereby over time may help offer some anti-aging, improve fine lines and wrinkles, and skin tightening effect. I think we definitely still need more literature on the true efficacy, and as far as comparing LED devices to microcurrent, I definitely feel there's more evidence in LED light devices. The other thing too is you have to use almost like a lubricant, a gel, ideally that is from the same company, so that works the best. This is something that I would use intermittently, really kind of before a big event, so that way my skin just looks tighter, looks more lifted, and most importantly helps to depuff. Now, as far as the actual time, if you're wanting to use that as your device, you have to use it, I believe it's 5 minutes, so it's definitely much shorter. And then you have to use it, I think like 5 to 6 days a week for about 4 to 6 weeks before you kind of jump into the maintenance though. So overall, the time commitment I think is probably very similar. It's just that I don't personally have the time to every day, or at least 5 out of the 7 days a week, to use a device 5 minutes on my face. So for me personally, I much rather invest in the LED mask that has more evidence, and it's also just a little bit more friendly for me with my schedule. All right guys, so those are the 3 devices that I use at home. Do you use any of these? Are you a fan of LED face masks? If so, let me know in comments below which one you like, and I'd be curious to hear your thoughts as well. Let me know if you have any other questions or comments, and then I will see you guys next time. Thanks for watching.